Hi, Hunt Bobo here. Welcome to Metabolism Diet and Health, Episode 5. In the last episodes, we've learned that there are some people that have vitamin deficiencies that are not common to other folks, like the small 3-month-old that had the thrombosed sagittal sinus, hydrocephalus, and required betaine to keep his homocysteine levels down and his blood clotting normally and not coagulating like jello. So in essence, he had a vitamin necessity called betaine. Beyond the essentials, I have not covered the need for dietary fiber, which is really not a nutrient. It's a bulk forming agent. The gut's made to pull the fiber through from the mouth all the way out to excretion. And without this, you don't get the inside of the intestine scrubbed, and you don't have the nutrients necessary for a healthy microbiome, which actually constitutes a greater proportion of the total DNA in our body than our mammalian cells have. So fiber is essential. And if you have a special bowel problem and had general surgery with gut resections, listen to what your general surgeon says. It may be that you need less or a different form of fiber. But as a rule, I just supplement mine on the advice of a doctor with Metamucil, 2 teaspoons a day, heaping teaspoons, about 10 to 11 grams. And it keeps everything moving better. Most Americans only get about 15 grams of fiber a day and need about 30 grams of fiber a day. The fiber is basically undigestible cellulose and other undigestible components, but absolutely necessary to slow down the absorption of glucose and other molecules. And it also traps some of the cholesterol in the intrahepatic circulation and causes you to excrete it. So it helps lower your peak blood glucoses and cholesterol in the body, and helps with the gut cleanliness and healthy microbiome to keep your immune system working right and all the bad bacteria that grow in the absence of these healthy microbes and cause illness. But today I'm going to talk about megadose vitamins. That seems to be all the rage, and there's numerous papers on high dose vitamin C, vitamin D. It turns out actually a moderate dose of all these nutrients is probably the best. Most of them can actually be toxic if taken in excess. Starting with vitamin A, as mentioned in earlier videos, the early Arctic explorers shot and killed polar bears and ate their liver, and several of them died of malignant cerebral edema caused by consuming hundreds of thousands of units of vitamin A in one sitting. 1 pound of polar bear liver would have a fatal amount of vitamin A in it, and for some reason this causes cerebral edema, and people get confused, comatose, and then die in 24 hours. So vitamin A, essential, best known for its combination with opsin to form rhodopsin, which is the pigment that signals light in the rods. But it has numerous other metabolic effects and was initially found to have just failure to thrive in children, and has been a worldwide problem in third world countries where they don't get enough vitamin A. They've even genetically engineered certain types of grain that produce vitamin A. So you don't have to have carrots to get vitamin A, but carrots and other yellow vegetables are a good source of vitamin A. It's oil soluble, so it's stored in the body for long periods of time. You don't become deficient in just a few weeks if you don't get enough. You have a store on board. The vitamin B complexes all have therapeutic thresholds. In fact, everything that we take in our mouth or our lungs has a therapeutic threshold, even oxygen and water. I'm talking about water going in the correct place into the esophagus and stomach. You can get water intoxication. I've seen a 34-year-old woman that had several gallons of water administered to her peritoneum during an extended OBGYN procedure, and she was brain dead from cerebral edema, from hyponatremia, and fixed and dilated, and died after just water, too much water administered. This could happen orally with certain types of psychological disorders, or other reasons to have too much fresh water go into your intestines. And I'm not talking about drowning, where they go in the wrong place and you get water in your lungs and you suffocate. But oxygen, you can only stand about 2 hours of oxygen at 2 or 3 atmospheres before you start getting pulmonary edema. And too much oxygen, even at normal pressures, 760 torr in people, after a day or two causes pulmonary edema. And in babies that require 60 or 80% inhaled oxygen in the neonatal period, they get retrolental fibroplasia, where the fibroblasts start to grow behind the corneas and lens, and they become almost blind from having this retrolental fibroplasia from excess oxygen in the neonatal period. The form of the vitamin B is important. Some forms are toxic and some are less toxic or not toxic. But again, everything has a therapeutic window. Too little, you get sick. Too much, you get sick and could eventually die. So B12, probably the best known B vitamin for being pepped up, probably dating back to the 30s when there were deficiencies around, is commonly cyanocobalamin. Too much cyanocobalamin can cause cyanide toxicity. Less toxic is the methylcobalamin or the hydroxycobalamin. It comes in several different forms. The most common one is the one that you can get sick if you take too many units, like 10 or 20,000 a day for several days. So there's a therapeutic window, and it's wider and safer with the methylcobalamin, but just normal doses of 1,000 units a day of cyanocobalamin are not going to get you into trouble. B6, pyridoxine, the common form of that is pyridoxine hydrochloride. I always grew up knowing that is the only form of B6, and it was the cause of peripheral neuropathy if it was absent in the diet. But too much of it could cause a peripheral neuropathy. In more recent vitamin formulations in the grocery store, the multivitamins, they have a smaller dose or no B6 in them. It's not the pyridoxine that causes the toxicity, it's the hydrochloride. The hydrochloric acid damages the nerves when you start getting above 25 milligrams of B6 per day in the form of pyridoxine hydrochloride. There's a form that's now available that's safer, pyridoxal phosphate. The pyridoxal phosphate is very safe up in milligram quantities even. I wouldn't take that much, but if you're taking 100 milligrams or less a day, you should be safe, and it's not going to cause neuropathy. They've taken it much higher doses. Folate. That folate deficiency was the primary cause of myelomeningocele, with the highest rate in the world in Ireland back 100 years ago, where they were living off of potatoes and didn't get many greens, many leafy green vegetables. It caused an open neural tube in the lumbar thoracic spine, and basically a paraplegic child. 1 in 400 children had spinal dysraphism, which is myelomeningocele, and were basically paraplegic or densely paraparetic from this. And all they needed was folate. Folate's essential, especially for pregnant women and every living human being. But again, everything has a therapeutic window, and if you get way too much, it can make you too sick. Vitamin C is the biggest one that's touted for megadose treatment of viral infections. If you don't have a G6PD deficiency, the glucose 6-phosphate dehydrogenase deficiency, it's fairly safe up into 50-gram doses a day, even though it could cause stomach upset. But a healthy metabolism can manage this. And there are reports that this has helped with viral infections from HIV, COVID, and even polio. I don't know what I think about this yet. Most of this was older, less scientific clinical studies, but it bears looking into and is interesting. So if you don't have G6PD deficiency or some other hemoglobinopathy such as beta thalassemia, you can go up to many grams without danger. If you do have a G6PD deficiency, you could die from taking more than a couple of grams of folate a day. There are over 100 different genetic mutations already identified that cause this G6PD deficiency. So it comes in mild and severe forms, and the effect of this excess vitamin C would be variable. But if there's any family history of it, I would certainly not go over 2 grams a day of vitamin C. That's ascorbic acid. And it does come in different forms. I have in my cabinet right now a calcium ascorbate, but some are safer than others. And all are safe up to 2 grams in an otherwise healthy individual. People who have had oxalate kidney stones and who have had uric acid kidney stones may have an increased risk of more kidney stones with high dose vitamin C. The vitamin C more recently in 2 gram and 3 gram doses has clearly been shown to decrease the ventilation time in ICU stay and mortality in COVID patients. I think this, sort of like the vitamin D data shows the same thing, is because the patients that didn't get this 2 gram or 1 gram supplement a day were probably vitamin C deficient and bordering on just a few milligrams away from having scurvy already, and you get a good response. This carries us to vitamin D, which also has a distinct therapeutic window. Excess vitamin D could even be fatal, can cause renal failure. But as long as you're keeping down under, 1,000 or 2,000 international units per day, you're safe. If you have renal failure, again, you need Rocaltrol, which is not the D3 form. It's the D4 form, or whatever the further metabolism is, because D3 is not active. D4 or D5 is actually produced in the kidneys. And if you have no kidneys, you can't produce the active form of vitamin D. You have to get it supplemented. And vitamin E, I was sad to learn that vitamin E above 400 units a day has been associated with decreased lifespan. For decades, vitamin E was thought to decrease heart disease and cancer. All that's been proven to be wrong. And I was taking vitamin E for many years after a friend of a friend that did spinal cord research had a batch of rats, the same species from a different supplier, that his model of spinal cord injury didn't work. All the rats that had the injury got up and walked off the operating table and had no spinal cord damage. So he went back and researched this with his original supplier and the supplier of the second one. The only difference he could find was the rats that were immune to the spinal cord damage had a vitamin E supplement in their diet. And then I started taking vitamin E thinking, well, that's great. I can use that. It had all these miraculous, wonderful things about it. So 20 years later, I find out that high doses of vitamin E are associated with decreased longevity and increased mortality. So I've dropped back down to just 400 units a day, and it may even be you only need 50 or 60. Originally, vitamin E was tocopherol, which means pregnancy. It prolonged pregnancy and stopped abortions. They had a bunch of women that were vitamin E deficient that were pregnant, and they would lose their babies, and they figured out it was vitamin E. And that's where it got its name from. Toco, like the tocometer that we check contractions in pregnant women with. So vitamin E is essential, but high doses over 400 units a day are possibly detrimental, and certainly, 1,600 or higher doses are definitely detrimental to long-term health and survivability. Vitamin K is fairly non-toxic, and K2 is the newer one that's been studied to show calcium removal from the arteries and better calcium deposition in the bones. The vitamin D, which was what we used for most of my career with calcium, actually helps take calcium out of the bones, put it in the blood. And excess vitamin D can actually cause your bones to get soft and break easier, which is basically the opposite of what I thought and what I was treating for. And the calcium above 2 grams a day can cause an increased cardiac mortality and heart attacks and strokes. So moderation is the key, and continually learning and reading and monitoring current knowledge and changing what you do based on new knowledge is important. Don't become married to one philosophy or one idea. Be ready to change with new information, and always be on the lookout for that. I hope this has helped some. Thank you very much for your attention, and join me next time when we talk about methylene blue and other agents that supposedly help prolong life and prevent death.